fluoridation smells? Yeah, that is. Okay. Okay, I think we've heard that. Let me check, I think. Okay, we're going to hear Senate Bill 312. If you'll come forward. That's Senator Mount and Senator Cheek, who's not here, who's one of the co-authors, and hopefully the committee members will consider co-authoring this as well. And we look forward to your comments today. If you'll introduce yourself for the record, and members, again, just to suggest to you that I offer up Senate Bill 312, which would amend current law to require all Louisiana water systems with 5,000 or more service connections to fluoridate to optimal levels. And that's just the overview, but the group before you has worked very hard in a very collaborative spirit with other groups, and particularly the local government groups, to have this opportunity to make the bill not only work, but make everybody comfortable with it.
Thank you, Madam Chairwoman, for those words. My name is Kevin Hayes, and I'm here on behalf of the Louisiana Dental Association.
I'm Ward Blackwell, Executive Director of the Louisiana Dental Association.
Good morning. I'm Susan Johnson with the Department of Health and Hospitals, Office of Public Health. I am the Oral Health Program Manager.
Madam Chairwoman and members, Senate Bill 312, in its current posture, tries to amend current law as it relates to the fluoridation of community water systems. Current law states that the intent of the program shall be to encourage each public water system that has at least 5,000 service connections to provide fluoridation of its water supply by January 1, 2000. Here we are in 2008, and we've decided it was time to make some changes to the current law as it relates to that. Even though the intent was well-founded, we were not able to supply a whole lot of communities with fluoridated water. I will bring some good news to you. There was a press release by DHH in the last couple of weeks that indicates that DHH and Crowley have worked together to fluoridate the water in the community of Crowley. So that is some good news, and we're hoping that with this legislation there'll be more such press releases. What the bill basically does is says that the intent is to fluoridate all communities in this state. The bill also says that we will do that when the funds become available to furnish the capital outlay, and the intent was for 6 months of the fluoridation treatment. I was approached by some folks with the Baton Rouge water system just a few minutes ago, and they asked to make it clear that on page 2, line 13, where it says up to 6 months, that it would say at least the 6 months, and we certainly wouldn't have a problem with that. And we're going to work with funding mechanisms via the appropriations process, various grants and such, to get some more money directed to the program.
Okay, let's stop just for a moment. I'll offer up that amendment. Members, this would be on page 2, line 13, and replacing for up to 6 months said system, we would then delete and add at least 6 months.
Yes, ma'am.
Is there any objection to that amendment? Hearing none, the amendment is approved.
Thank you. Another thing the bill does is there's a question of cost. With the various community water systems that are throughout the state, no one has a really good handle of what type of capital outlay costs we're looking at. So the bill is going to require the various water systems to report back to DHH how much would it cost to do the capital outlay and the fluoridation for 6 months. The municipalities wanted to make sure this was not a mandate. That's why we indicated when funds become available, so we addressed their concern. And some municipalities wanted an opt-out provision, and so that's what is addressed in Section 4 of the bill, is an opt-out provision. We have worked with all the groups, and thank you for your leadership, Senator Mount, in moving this forward. I will mention a few things to you. 47 parishes in the state are designated as dental health professional shortage areas. Louisiana has only 2,212 licensed dentists. 27.5% of the children enrolled in the Medicaid treatment receive dental treatment, and only 14.9% of those receive preventative treatment. Fewer than 40% of residents in Louisiana benefit from community water systems. A study was done through the Department of Health and Hospitals looking at issues related to funds and reimbursements and such regarding insurance. And it was clear that Medicaid-eligible children in communities without fluoridated water were 3 times more likely than Medicaid-eligible children in communities with fluoridated water to receive dental treatment in hospitals. Obviously, this is very expensive, and we feel that this bill will assist in that preventative treatment and ward, and the people at DHH may have a few words.
Thank you. As Kevin was beginning to touch on there are very clearly documented health benefits from community water fluoridation. It's in that particular Louisiana study. There's also cost benefits associated with it. Roughly $38 worth of dental treatment you save for every dollar spent on community water fluoridation. When you're looking at the cost from Medicaid, it ranges from $14.68 in comparative savings. When you look at non-fluoridated parishes versus fluoridated parishes for 1-year-olds, all the way up to $58 for 3-year-olds. The actual reduction varies considerably in terms of decay because there are other factors, the access to dental care and other general health of the children. But generally speaking, in children, you'll see 18 to 40% reduction in the incidence of tooth decay in fluoridated communities compared to non-fluoridated. 35% reduction in adults. Now, a lot of people who are not necessarily fans of fluoridation will cite safety issues. There simply are no documented safety issues. Over 60 years worth of research, more than 5,000 studies have been done that conclusively demonstrate it is safe and beneficial. There will be at least a few studies out there that will show us something otherwise. They're generally flawed. They might say there's increased incidence of cancer. The American Cancer Society has looked at all the research. They issued a statement that fluoridation clearly does not have any association with increased incidence of cancer. Other people worry about osteoporosis. We can easily try it out for you. 5 separate studies done in the past few years published in peer-reviewed medical journals that all show there is no correlation between brittle bones, osteoporosis, and water fluoridation. So it's safe. It has proven health benefits. It's cost effective. And it really is not all that expensive. The actual cost per year typically is about less than $4 per person, or roughly $1.30 per month for a family of 4. Demonstrated, obviously, there are cost savings to the state because you're getting multiple times over your investment return and save Medicaid savings based on a study done here in Louisiana. All we're really basically trying to do with this particular bill is move the process along. As Kevin alluded to, existing law tried to encourage communities to fluoridate for many years. In the 11 years since the original bill passed that created the Water Fluoridation Advisory Board, fewer than half a dozen communities have actually been able to begin fluoridating. Cost has been a big obstacle, but education is one as well. It takes a long time to bring people up to speed on this. And there's just not a whole lot of people able to work on it. We're trying to address that issue as well. We've worked with LRWA to address facilitating getting the information, helping communities come up with the cost estimates. Their executive director has postulated there might be a way for his association to help get experts out there in the field to assist the various systems. And that's 30 or 40% of their membership would be directly impacted by this. And they're working with us, and they have no opposition. DHH has been working with us as well. They actually helped us produce some PSAs to begin the education process. It's basically a very widespread coalition of folks who would like to see this go forward. I guess I would be best now to turn it over to Susan. She is the expert on fluoridation in the state of Louisiana, and she can answer a whole lot of questions and provide much better information than I can.
Thank you, Ward. I sort of really wanted to bring everyone sort of up to speed on where we are currently in fluoridation in Louisiana. And I believe, as Kevin stated, we have less than 40% of the population receiving optimally fluoridated water. Of that, about 5% of that actually have natural occurring levels in their own water systems. And so they are not adjusting. So when we look at fluoridation, we look at those that occur naturally, those that we adjust, and then there are systems, and our state has numerous water systems where water system adjusts and then sells their water to another community for their water. So essentially there are 46 or so communities in the state receiving fluoridated water. And of course, the most recent to come on board was Crowley. They should begin fluoridation tomorrow. And that it was about a 2-year process, and that's really what we see in the last couple of years. It's about a 2-year process for every community. The town of Walker is the next one that we are hoping to get online in the next few months, and we've been working carefully with them. The fluoridation program at the Office of Public Health, we provide communities with education, with information on fluoridation. We assist them with the engineering required. The engineering section of the Office of Public Health always has to approve plans, and we move forward from there. And lately, we've been able to assist with the purchase of the fluoride additive for at least 3 months, the first series of operation. The Healthy People objective, Healthy People 2010, is actually 75% of a state's population will receive optimally fluoridated water. We were at 50% prior to Hurricane Katrina, and of course, with the decline in the population of New Orleans, that was affected, and it really has set us back. We are climbing slowly back up to 40% with the addition of Crowley, and as New Orleans came back on board in the last couple of months, then we're going to be hitting very close to that 42, 43%, and we'll steadily climb from that.
All right. Thank you very much. I don't see that there are any questions. Let's see, we have one amendment, so Senator Cassidy offers up that we report the bill favorably as amended. Is there objection? Hearing none, we will report the bill as amended favorably.
Thank you, Madam Chairwoman, members of the committee. Have a good day.
Thank you. And I didn't say that was SB312, but I should. Okay. All right. I want to thank the committee for taking care of business while I was downstairs working on term limits. But we have one bill left, as I've been told, and that would be a couple more. Okay, let's see. Senate Bill 49. Yeah, 694 is deferred. Senate Bill 49 is deferred. That's Senator Cheek's bill. Senate Bill 70 is deferred by Senator Cheek. So the only one we have left is Senate Bill 540, I believe. Is that correct? Everybody agrees with me? Okay, Senate Bill 540. Before we do that, let me read into the record on Senate Bill 312. Pat Crater with Louisiana Rural Water in support of, Sandra Adams, Louisiana Maternal and Child Health Coalition, and the Louisiana chapter of the American Academy of Pediatrics in support of, Ward Blackwell in support of, Jane Bergen with Louisiana Dental Hygienists Association in support of. Okay. All right, let me get that bill together. Okay. Members, this is Senate Bill 540, which provides for the moratorium on the issuance of hospice license and provides for the process of application. You would introduce yourself for the record?
I'm Sylvia Marcantel from Lake Charles, Louisiana, President of the Louisiana and Mississippi Hospice and Palliative Care Organization and District Manager for Odyssey Healthcare.
Okay.
I'm Nelson Wagesback. I am the CEO of Hospice of Acadiana in Lafayette and Bayou Region Hospice in Houma. And I also serve as a national director on the National Hospice and Palliative Care Organization, which is the largest association representing hospices across the nation.
And I'm Stephanie Shedler. I'm a Louisiana Mississippi Hospice Organization board member. I am the owner of 4 hospice providers in